name badges here. All right, everyone. This is one of the suites, and nobody's in here right now. The one person is teleworking, and yeah, they're teleworking. There's 4 desks in here. One was working with this mobile van, and the funding got cut for that. The other person, we used to co-present. They've since moved to another state. And the person directly back here is teleworking. They do give an option for the employees here to telework once a week. And yeah, they're teleworking. I did a presentation down in there's a small auditorium. Hang on, there's a spam call. It was a spam call. So anywho, I did a presentation in they have a small, they call it an auditorium. Anyway, I did a presentation. It was a one-on-one presentation. And I mean, it went well. This coming weekend, I'm going to be at a health fair, and I'm essentially giving out pamphlets. The other thing is, next week, I'm going to be going to a nonprofit to do a presentation. They're training all their staff. And this grant that I'm working on particularly is focusing on Black and brown people. And yeah, so this is one of the target audiences. I have one more class scheduled. Let's see, this Saturday. How many classes do I have scheduled? Okay, 2 more classes scheduled, 1 more health fair, and timer's going off. And essentially after that, that'll be it. That last day, I'll go ahead and come in and I'll just get everything in order. I'm going to need to bring back a shirt. So I'll probably wear that shirt I think what I'm going to do, I'm going to wear this shirt. I'm going to wear the shirt this Saturday. And then after that, I may wear it again when I go to that facility. And then after that, I think that'll basically be it. I'll probably go ahead and wash it and just bring it on in here, because the last day, basically I'm going to come in here and just make sure the desk is straightened up, which is not really much here. And the shirt's here. Go check in with my supervisor and hand my badge in and everything. And that'll be it. So that'll be at the end of March. I applied for a lot of jobs, and I just trust in God's timing. I had applied for this merchandising job, which they offered me the position, and I just feel like they were not telling me how hard that job was going to be. And I don't mind to make a low wage if it's a very light job, like putting things on shelves at a retail place. But I just think that they were telling me, and I just turned it down. I've been getting lots of recruitments about being full-time public health nurse in this area, but I'm not really necessarily wanting to do anything full-time. I had interviewed for a job in Atlanta, but then they were offering this salary, and I knew I was highly qualified for it, but I said I want my salary to be negotiated. And then I didn't hear anything. I said, I am not going to accept that entrance amount. That was less money than I was making when I left public health in Atlanta. And then I applied for this other job, public health job. The supervisor was in the same office I used to work out of when I worked briefly as a clinic manager, until I did a voluntary demotion, because I really didn't want all that responsibility, because I had young children. And before I left the job for that it was like a PHN3. I got an outstanding rating, and it was strange because when I did PHN2, essentially the person that was over the eval was saying nobody can get an outstanding. So it is crazy. But anyway, perfect score on immunization inspection, outstanding rating. Yeah. So anyway, that interview, they were asking for all kind of things that I have not done, like budgeting and grant management and stuff. And I said, and they made it like you were like maybe a coordinator. I said, so let me just make sure I understand. You're offering $67,000 for all that stuff you just described. Am I right? And they were firm like, and this is what you're going to get. By that time, I already knew I didn't have all that experience they were talking about. And frankly, I wouldn't want to do it. And the person that used to do this job, the person that was asked the questions knew my background. I'm just like, no, I don't have all that experience. And I was okay with not having that experience. So anyway, a lot of the children's hospital jobs, a while back, when I was a public health nurse, I applied to be a advice nurse, and the lady was going to call me to offer me the job. She's like, I was going to call and offer you a job. That was like the week that my husband passed away. But she's like, I was about to offer you the position. So the qualifications they had before, they had way less qualifications now. They want so many certifications. And what they tend to do is they hire from the inside. So the furthest I've gotten at the children's hospital was for a case manager job. And I just really felt they were going to hire from the inside because I was not a certified case manager, but I was highly qualified. So they did call me back for the second interview. And they also invited me to come and spend a day with the case manager, which, by the way, I really appreciated. But then they let me know they hired a nurse from the inside that had their certified case manager. I just decided to apply for this job I applied for a while back, an advice nurse, the one that I was about to be offered the position right before my husband passed away. But now they have so many certifications. They say preferred, pair, and and they're saying you can get it within a year of hire. But the thing is, why would you hire somebody that doesn't have the certification when you could hire someone that does have the certification? So anywho, still working at the hospital, and public health contract job is going to end soon. I still have my LLC where I can teach CPR classes. I started going on there because they did say the bidding was open for April, but I really didn't see any places that were in the general metro Atlanta area. It's possible they might have not posted it. It's also possible that this bidding site, it doesn't make sense. So anywho, I'll probably get on there again and see if I can find anything. But anyway, let me go ahead and get to my car. I said that I was going to talk to y'all before, and I'll see you when I get back to the car. But this is the office. I got to be careful. Just trying to be careful that there's nothing private. Okay, yeah, there isn't. Let me go ahead. I'm going to go ahead and turn it around. Hang on. Put it up here. Yeah, you can see coat hanger. The office. And I'm out of the office. I mean, that's really a nice office. It's really a nice office. Yeah, the end's coming up for that. I started thinking about it and looking, where I was right before I semi-retired, and I felt like a little twinge of sadness knowing that job was going to end, but I think that it served its purpose. It's been very healing to be able to come up and do presentations and get positive feedback.